Welcome to the Holistic Oral Health Summit. I'm your host, Jonathan Landsman. Did you know that 80% of disease symptoms are related to problems in the mouth? As a health and fitness consultant for nearly 30 years, I believe this is one of the most overlooked problems within conventional and integrative medicine. That's why I created this summit, to help you identify, prevent, and eliminate the roots of disease. Our show today, how to stay healthy in a chronically inflamed world. Our guest, Dr. Thom Lokensgard, is a holistic biological dentist who is naturopathically trained and boarded with the American Academy of Anti-Aging Medicine. He looks at dental problems and infections through a naturalistic and anti-aging lens. He received his Doctor of Dental Surgery degree from the University of Minnesota in 1980 and his naturopathic medical degree in 2007. He specializes in the International Academy of Oral Medicine and Toxicology Protocol for safe mercury removal and is currently undergoing accreditation. As a well-known holistic dentist and educator, our guest is widely sought out by patients who travel a great distance for his care. Please join me in welcoming Dr. Thom Lokensgard. Dr. Thom, welcome.
Thank you, Jonathan. And before we begin, let me thank you for what you're doing and the passion that you have to bring this to the world. It's an honor to be a part of your program. So thank you for inviting me.
Let's talk about, to start this program, exactly what is anti-aging to you, integrative, and or what some people might be throwing around the term functional medicine. Talk to us about that.
Okay. Well, first of all, I would say let's talk about what I would call prescription pad medicine, and that's symptom-based medicine. And I think that that's the direction our whole country has gone in over the past few decades. So functional medicine it promotes wellness by focusing on the fundamental underlying factors that influence health and disease and the whole process of health and disease. Anti-aging medicine is a medical specialty, or let me say subspecialty, in a field of scientific research aimed at early detection, prevention, treatment, and reversal of age-related decline. So we're talking about hormone balancing, neurotransmitter balancing, which I know we're going to get into a little bit, and basically getting it. The key thing is that we're getting at the cause of what is causing your problems.
And what a great opportunity for someone to be able to find a dentist like you who also has, medical degree training. I mean, to really get that holistic approach, if you will. I'd like you to talk a little bit about the philosophy of naturopathic medicine and how you incorporate all of this into your dental practice. I mean, this is very important, Dr. Thom, because not only do we have the general public out there concerned about their health, but we have a lot of healthcare providers listening to this program, especially the dentists out there.
Well, the way I look at it, Jonathan, is that we, specifically as dentists, DDSs, we have an obligation and a responsibility to tell our patients, because now, back in 2001, I believe it was, the Harvard Medical School linked cause and effect. They linked periodontal disease to cardiovascular disease and other low birth weight babies and some precancerous and cancerous type diseases also, and they linked it to dental infections. So like I said, we have, as a profession, we have an obligation and a duty to inform our patients that their dental infections matter. Their dental infections are what is causing a lot of their systemic problems, and so that's kind of what I look at everything through an anti-aging and through a naturopathic lens, meaning, you asked a question about naturopathy, and naturopathy is basically, I believe, and my whole philosophy is this, is that the good Lord gave us cells that are DNA programmed to heal themselves automatically. And given the right substances, given the right nutrition and the nutrients, and because we don't really run on pharmaceutical drugs, our bodies were not designed to do that. We run on nutraceutical and supplemental, food, nutrition, etc.
Dr. Thom, I hope that people don't feel like this is a side, going off topic, but I'd like to get your comments on this. I mean, as we're talking about things the way you are right now, the title of this whole program is How to Stay Healthy in a Chronically Inflamed World. I think it's about an attitude, which I already hear from you, is that, conventionally speaking, the attitude is sort of to pervasively teach people that, inflammation, which certainly is something that they even admit is not a good thing to have, is coming from sort of outside influences. It's major enemies out there. You have to be afraid all the time. You have to try to kill everything and be worried all the time. And so much fear-based education is involved with all of that. Yet when you're talking about being a naturopathic physician and a holistic-minded dentist, you're really talking to people, as you've already just said, about how we have power to heal ourselves, that we don't have to be so afraid even of being inflamed, right? Because we can heal. Isn't this fair to say?
Yeah, exactly right. If Jonathan, we give our bodies what they were designed to run on, and a guy I know in Baltimore, it was an MD and ND, and he had a slide up in a seminar that I attended, and it said, "You cannot pharmacologically intoxicate someone into health." And I thought, wow, that's a pretty brilliant statement. But that's what we try to do in symptom-based medicine, is that we try to pharmacologically intoxicate people into health. So you mentioned chronic and silent inflammation, and so let's take a look at some of the causes of that. And what really causes silent inflammation are all these things that are lifestyle. It's basically lifestyle driven. So you're looking at chronic stress is a huge stressor. You're looking at indoor and outdoor air pollution. You're looking in dentistry at heavy metal toxicity, trans fatty acids. We can talk about the cellular membrane integrity, which is not good because of the plastic fats that we eat today, inflammatory foods, not enough sleep, low hormone levels, on and on and on. You can talk about pesticides, insecticides, preservatives, but the greatest culprit of all, in my opinion, this is just my opinion, is that the standard American diet, we call it the SAD, standard American diet, because it's so acidic and it's so inflammatory, is a huge factor. Coupled on top of that, we can add in a few things like, I got to get my kids to school, I got to get my kids up, we're worried about financial issues, we're worried about family problems, and on it goes. We live such a stressful life that it contributes to the inflammation, which becomes chronic.
But I mean, certainly, Dr. Thom, I'd love to get your thoughts on this. The idea that someone says, well, hey, it's just I have a very stressful lifestyle. But, person A has a very stressful lifestyle. They may have an even more stressful lifestyle than person B, but yet person B is not eating as well as person A. So, I mean, talk about that a little bit,
Right. Well, we all have, each one of us has a burden, a toxic body burden and a load, and we have cytoplasmic transcription switches, which are little genetic switches. They're little hormones that are affected by our diet. What I call it is dietary endocrinology, meaning that what I eat affects my hormones, and what I also eat affects my gene transcription switches, in which when you eat something that's completely acidic and artificial, you're ending up with a plastic cellular membrane that is not conducting voltage. And so, we could talk about all of these alcohol and smoking and UV radiation of fast foods, but the bottom line is this: what we eat affects our hormones, and what we eat also affects our genetic switches. And so if we're eating trans fatty, acidic foods, and we're under a lot of stress, and it's causing, we're not getting enough sleep, this kind of thing, it can really affect the way our body processes the foods. And when there's an injury to our body, the voltage increases, the oxygen comes in, the body it heals itself naturally, like we said, and then it returns to normal. But today we're under so much stress that it's affected our lifestyle, and it's caused obesity, and it causes a lot of stress-induced type disease states that are unhealthy, and they're causing all kinds of problems.
So, Dr. Thom, why don't we crystallize this with people? Because a lot of people tend to think, well, hey, it's, just my emotional state or a stressful job that's creating all of these problems. But the point to remember is, like what you're referring to, is that the foods that we're eating actually have an impact on our nervous system. I mean, I'd love for you to talk a little bit more about some of those physical assaults on the body that are actually causing this inflammatory state. But what I also want to get into, that I'm sure you would agree, is that when we ignore the kind of foods that we're eating, this kind of over and over again inflaming the body with the wrong kind of foods and beverages that we have can actually have an impact on our emotional state, on our ability to perceive things, whether they're okay or not, is really a matter of how well we're eating. If we eat better, we can literally handle more stress. So please, Dr. Thom, talk about some of those things that we really have to be careful not to overdo.
Okay, so you're dead on the money, Jonathan, with respect to how this affects our health and our body. What we're talking about, and what I think you're alluding to, is alkalinity and acidity. We have a very acidic diet, which causes problems. What we want to do is we want to achieve an alkaline diet, and that is where you have more minerals. This controls our immune system, and a lot of the foods that we eat cause leaky gut syndrome, cause all this autoimmunity, and it causes problems in the vascular system, the cardiovascular system, and also the gut. You see, your immune system is your defense. It's like your Navy SEAL SWAT team. And so when you eat foods that are inflammatory, what happens is the gut wall spreads out, and it causes leaky gut syndrome. And what happens is the protein that doesn't get digested well goes into the bloodstream, and your body begins attacking it, which is what we call autoimmunity. So that's one issue right there. We can talk about heavy metal toxicity, which is what I deal with. And what happens there is you have heavy metals that are crossing the blood-brain barrier, ending up in the fatty tissue of the brain, causing all kinds of neurological problems and loss of memory and fatigue and that kind of thing. So you have to be very careful about the eating of fatty fish, and you have to keep your food supply non-GMO, which is genetically modified. You have to keep it organic, and you have to stay away from sugar. Sugar is probably one of the biggest offenders, which causes high triglyceride levels. And it's not, we've kind of been sold a bag of goods here, or a rotten bag of goods in this low-fat, high-sugar diet that America has kind of purported on us, because it isn't the low-fat. We need fat. We need healthy essential fats. What we don't need, Jonathan, is a bunch of sugar, especially a bunch of modified sugars and neuroexcitatory type sugars, which are like the aspartames and the splendas and all that kind of thing. So getting away from sugar and increasing your foods that are non-GMO is the way to fly.
And again, Dr. Thom, what I was referring to before that I would love to get your comments on is this idea that, if we don't get this inflammation under control because we're eating the wrong kind of foods, or perhaps even with not addressing with a dentist like you, the mercury that's within the body, literally coming out of all these mercury fillings, which we've talked about a lot during the summit, that the idea is when the body gets so intoxicated with all of these chemicals, the artificial sweeteners that you mentioned, all the poor food, the lack of good, high-quality, healthy fats, all of these things, that we end up then feeling more brain fog, we feel more agitated. It could be simply the fact that, an individual is really too toxic, which is why they're reacting so poorly. I mean, this is what we have to get under control, no?
Correct. What you're talking about is we cause, by eating those types of diets, we cause excitotoxicity, we cause mitochondrial energy depletion, which is the mitochondria are the little energizer bunny batteries that are in your cell that produce energy. It produces hormonal imbalance, fatty acid imbalance, digestive enzyme deficits. But what it really boils down to is free radical oxidative stress, which means your cells can't handle the toxicity, and so then you have to begin the detoxification process, because what happens is we overwhelm the body with all the toxicity that is now coming into the cellular membrane and in through the cellular membrane into the cell body.
So the bottom line is, when an individual that you see, Dr. Thom, who's suffering with so much chronic inflammation, I mean, their ability, their threshold to be able to handle things during the day, their energy levels, I mean, talk about that. How low are they compared to when you actually alleviate some of these inflammatory markers that are going on in the body?
Well, that's a great point. And what happens is they come in and, what I hear is they're under adrenal assault, and plus they're aging. I mean, we have an aging population. And as you age, your hormones decline, your neurotransmitters are declining, your toxicity levels are going up, your fatigue levels are going up. What's going on here technically and physiologically, Jonathan, is you have oxygen depletion. And here's a kind of a neat little scenario. Let's say you have a dental infection in a root canal. In a root canal tooth. and you take an x-ray, and I see this every day. I see this every day that I work, where you have a dental infection, and you see at the end of the root, and what'll happen is you have a decrease in pH there, you have a disruption in the meridian, and you have a depletion in oxygen, and now you have the bugs that come into the area, and they wake up because the oxygen is low, because these bugs are anaerobic bugs, and then they begin kind of munching on us because they become hungry, and so they begin producing enzymes, and this causes more toxicity, which affects the meridians even more and affects all the organ systems because the teeth are tied to the organ systems. And so you have this cascade, you have this immunological cascade of things going on, and people come in and they go, Doc, I don't know what's going on with me. I can't perform like I used to be able to perform. I get tired and sleepy during the day. A lot of these people are dehydrated because they're not drinking enough adequate water to flush out the toxin. And so what we do is we do a tri-test. We do a heavy metal tri-test, and we kind of determine what toxic levels they have with respect to heavy metals. And we can also look at methylation deficits and energy deficits with adrenal testing and so forth.
Yeah, Dr. Thom, that's a perfect segue into what I'd like to talk about a little bit more, because obviously now people get it. They're listening to what we're saying about how when you just ignore all of this inflammation, it is directly connected to, yes, infections in the mouth, but as it cascades throughout the whole body, it's affecting the brain. It's affecting your ability to breathe when you try to exercise or have energy during the day, or to be able to think and stay focused during the day. All of this is severely compromised with inflammation. But obviously, people are going to be wondering, what do you do, Dr. Thom, to try to test this and figure out where somebody is at? What do you do?
Okay. The cool thing about testing is that there are so many new tests now, and the cost of these tests, because there's so many anti-aging labs that have brought the cost down and can test all these, what you're calling the inflammatory markers. So we look at a couple things. We look at what medium to test in first. So are we testing in saliva? Are we testing in blood? Or are we testing in urine? We can do also hair analysis, and we can do comprehensive digestive stool analysis. So what I try to tell my patients to do, or what my patients usually bring me, are comprehensive digestive stool analyses that tell me the level of their gut function, because we all know that disease starts in the gut. And so if your gut isn't working, you've got issues. So we go there, and then we do another, what we call an LCAT food testing, which is a food sensitivity test, which tells us what foods that you're sensitive to and where your autoimmunity might be coming from. Then we can do Candida albicans testing, and another one that we use in our clinic is a serum compatibility test. It's a blood draw, and people come in, and we'll send this out to Colorado, and they'll put all of these dental compounds and dental chemicals against their blood, and it'll tell us what they're allergic to, or what they're most compatible with and what they're not compatible with. Because when we talk about biological dentistry, what we're really talking about, Jonathan, is what materials in your mouth and in your body are the least reactive. Because of all the toxicity, we want that to be as least reactive as we can, because that's otherwise you're going to continue to overwhelm your immune system. We can also test for vital neurotransmitters. We can test for osteoporosis. We can do, here's a real important one, we can do a 4-point salivary cortisol. When you test in specific mediums, here's what I want your guests to understand, is that when you test a hormone, or when you test anything in blood is a transport medium. So what you're testing is the hormone or the neurotransmitter that's being transported in the blood. It's usually bound to some kind of a binding protein. When you test in saliva, what you're testing is the intracellular filtrate. When you're testing in urine, you're testing the metabolites, or what's been burned. It's kind of like your checkbook. If you want to know where you spent your money, what do? You look at your check ledger, right? Because that tells you where your money went. So if you want to see how your metabolites and how your neurotransmitters and how your hormones are being spent, you look at the urine. If you want to see how they're being transported, then you look at the blood. If you want to see where they're working in the intracellular fluids, then you want to look at salivary testing. And so we have a lot of companies that can do that for us. But a lot of my patients will bring in the test for me, and then we'll kind of analyze them and take off from there.
But Dr. Thom, I know this might be very complicated for people to be listening to, but essentially there's a lot of deception in somebody testing one aspect within their body and then rushing to reach a conclusion, right? What I'm referring to is this idea that well, you test your urine and you say, well, gee, I don't find anything there. You must be clean. That's not necessarily true, right?
That's exactly right. And here's what I'm not suggesting anybody go out and start doing all this testing on their own. The first thing I'm going to say is that you need to put together a healthcare team. First of all, you need to take responsibility for your own health, because all of us in this day and age, we need to take responsibility because you know your body better than anybody. What I tell my patients and what I work with my patients is we're putting together healthcare teams here. You need a good naturopath. You need a good medical doctor who's integrated or who's anti-aging. You need a good chiropractor, because chiropractors really understand the nutritional aspect and component and the neurotransmitters and the nerve part. And you need to put together a good biological dentist, because a lot of your problems are coming from your dental infections. So I would say get rid of your dental infections. Now, as far as the false testing and false results, you need to be testing in the right medium. You need to be testing for the right thing. A lot of our patients come in with methylation defects. Methylation defects cause detoxification issues. People have an ability that they can't detox well, so you need to test for MTHFR, and you need to find a physician who understands that kind of testing. But the testing ranges, Jonathan, are so large. When you get a CBC panel or you do a hormone test, the testing levels are so large because there's so many sick people in these samples that it's really difficult to know if you're in a range. Let's say the range is from 0 to 1200, which it is for testosterone. If you're at 20 and you're still within the normal range, and a lot of physicians will say, well, you're normal, you're in the normal range, or if you're way high, you're normal, but most people operate best in the optimal range, and so you need to put together a healthcare team that will help you figure out what your optimal range is.
Like, for example, as we're going to be talking about hormones and neurotransmitters a little bit more, but can you be a little bit more specific for those people out there who are going to be curious about some of the testing that they should be asking their dentist for or their integrative medical provider, and what exactly those tests will reveal?
Good question. Okay, what you need to do is, first of all, you need to find a physician and or a DDS who is well-versed in these types of testing. You need to run a basic, depending on your age, if you're over 40, if you're, say, 35 to 45, you need to run a hormone panel. And the hormone panel would be simply your estradiol, which would be your estrogens, your estradiol, your estrone, and your estriol, and your testosterone. You need to run a thyroid panel. And here's where a lot of my patients come in, and they'll say, okay, I did a thyroid panel, but all they tested was TSH. TSH is thyroid stimulating hormone, and it's actually it's an anterior pituitary hormone, and it really isn't even a thyroid hormone. So you need to find a practitioner who can help you put together panels. Now, we have a program that we do here at our practice where we can help you put together your T3, your T4, your free T3, your free T4, your TSH, your reverse T3, your TPO antibodies, and so you get a complete picture of what's going on with your thyroid, because just testing TSH is not enough. Same thing with like sleep. We have a lot of people that have sleep apnea now, and so you need to do a polysomnogram test. You need to find a physician who can do a polysomnogram depending on your state, regulations, and who will tell you your hypopnea index, which will tell you how many times a night you're not breathing, or say per hour that you're not breathing. Then you need to come into us and have somebody read your polysomnogram test, and then determine whether you're going to go on a CPAP machine or whether you're going to go on a dental appliance to help you keep your airway open. Because if you're not sleeping at night and you have adrenal fatigue and your thyroid is not working well and your neurotransmitters are low and your hormones are imbalanced, you have some problems, and you need to start looking at all those different aspects and not just run a complete blood panel or a complete blood count and think that if you fall within the normal range, you're going to be normal, because you're probably not normal. One physician friend of mine says, Tom, he goes, these tests, they're so broad and the ranges are so long. What it really means, if they tell you you're normal, is that you're normally screwed up like everybody else your age.
So talk a little bit more, Dr. Thom, about this whole idea of balancing hormones and neurotransmitters. I mean, give people an idea. What are we trying to shoot for realistically, and why is it so important to shoot for those things? Talk to us.
Okay, so the best way I can put it is this. Your body is like a symphony. And in a symphony, if the bass is too loud or if the violins are too loud, then everything's out of balance and out of whack. So each one of your hormones has an optimal range in which it will operate. And that's enzyme dependent, that's pH dependent, that's oxygenation dependent, and it's also age dependent. So what you have to do, you have to get a complete panel. Say, let's take neurotransmitters, because we've mentioned that a number of times. You've got to look at your histamine levels, you've got to look at your phenylalanine levels, you've got to look at your norepinephrine levels, and you've got to look at your epinephrine levels, your histamine, histidine, which is an amino acid, and you have to look at your tyrosine levels, because that has a lot to do with your thyroid gland. And if you're not sleeping, it's not just about melatonin or serotonin, it's also about histidine and some of these others that we mentioned. It's about histamine also, because if you're waking up at night, depending on what time of the night you're waking up, you could have a neurotransmitter imbalance. So you have to zero in which neurotransmitters are not functioning correctly, because that has to do with your parasympathetic and your sympathetic nervous system. Your sympathetic nervous system is your fight and flight. Your parasympathetic is your eat, sleep, and drink, and digestion. The problem with most of us today, Jonathan, because you've been hitting the nail on the head here in every one of your questions with this chronic stress in our lifestyle, is that most of us are in what we call sympathetic overdrive. Sympathetic overdrive means we're always in fight or flight, and we weren't designed that way. We're designed like sports cars. We're supposed to become inflamed, get over, and then we rev up and we run for a while, and then we heal, and then we slow back down. But today anymore, with the computers and with family problems and electricity being on all night, we can stay up all night now, and with video games, etc. We can burn the midnight oil 24/7, and that's not healthy, and that's not good for us. And so what we need to do is really go ahead and test all of our levels and get them in the proper range. And you need a good physician. You need a functional physician. You need a good biological dentist. You need a good naturopathic person, and you need to put your team together, and you need to have your team working together with you and for you, because it's gotten too complicated. Our healthcare system, which is not even a healthcare system, it's more of a disease control system, is not really designed to help you much other than to mask more symptoms.
Well, Dr. Thom, the picture that you're painting is already very clear. This idea that, number one, we do have to have the right attitude first for ourselves, and then find those people that resonate with us to really help us along in this process. Because, just take, for example, when you're saying we need to balance our hormones, and someone would say, sure, that makes sense, but yet completely just sort of quickly say, well, I don't sleep so well at night, but whatever, I've got a busy day the next day, I've got to go on with things. To not be sleeping well, to have cortisol levels elevated, to have your adrenal glands always be cranking out, to never get that relaxful state at night, you're going to be in so much trouble the next day. Isn't that fair to say?
It's fair to say. If you look at, there's been numerous studies on truck drivers who, end up in accidents because they can't sleep and they're on the road. There's been, pilots where there's problems, with flight crews because they're not sleeping. But yeah, we were wired to live in an age in time with no electricity. Well, now I'm sitting here in my nice building here with the lights on and the computers on, and I'm talking to you, and we could be doing this all night. But we really you need 7 to 8 hours of restful sleep, and you need to hit that REM sleep, that rapid eye movement sleep, because that's when your human growth hormone occurs. That's when your liver is not in REM sleep, but around between 11 and 2 p.m. is when your liver begins to detoxify. The human growth hormone is released. But if you never get to that REM sleep, all kinds of things, you don't detoxify, you don't store your long-term memory. All kinds of bad things happen if you're not sleeping.
That's the truth, Dr. Thom. And I heard something so interesting just on the level of having melatonin levels. And we're going to get into some of the non-toxic, natural ways to improve our health. That's the way we're going to finish this program. And boy, is it going to be worth every minute for us to talk about this. But the point that just melatonin alone, if it's too low at night because we're so jacked up, we're on computers and all the lights that are on and on and on and on, that we literally can't shrink our brain at night when we're asleep to try to flush out those toxins. That blew me away. It just gave me such a higher level of respect for how important it is to get our melatonin levels way up at night so I can get a better night's sleep. Wow.
Yeah, they're cranking melatonin levels up for cancer. It turns out, Jonathan, that melatonin, the way it affects sleep deficits is it decreases your sleep onset time. So the minute you hit the pillow, like you said, if you're way low, you're sitting there and you're rehashing all this stuff in your brain, and you're saying, oh, I can't get to sleep, and so finally you toss and turn, you wake up your spouse, you end up probably in the kitchen drinking some water or trying to figure out how to go back to sleep. So you've got to raise your melatonin levels up, and we used to start. I was trained to use like 1 to 2 milligrams maybe of melatonin, but now they're talking much higher doses, between 15 and 20 milligrams, and even upwards of that for anti-cancer, because it turns out it's a great antioxidant. But its main function in sleep is to decrease that sleep onset time. And so if you're having trouble getting to sleep, there's getting to sleep, there's staying asleep, and there's waking up and then getting back to sleep again. There's all kinds of problems, which is why you need to do a complete neurotransmitter study. And let me give your guests a laboratory that they can check into. It's called Neurosciences Laboratory. It's in Wisconsin. They do hormone testing, but they have a tremendous adrenal sleep study panel. But Neuroscience Laboratories does a fantastic job of righting a lot of these wrongs in neurotransmitter function. So that's one to put on your radar. Another one for hormones is ZRT, and they're in Beaverton, Oregon. And some of these tests, you can talk to your physician, talk to your nurse practitioner, talk to your dentist, and say, can you order this test for me, or more importantly, can you have somebody read it for me who understands what they're talking about?
All right, Dr. Thom, here's where I'm just giving everybody the heads up. Get a piece of paper and a pen or a pencil out. Let's just go up on the helicopter now and take a look from the top down, Dr. Thom, when we're looking at some of these natural, non-toxic ways to improve health. We've talked about so many different things, but let's go through some of your top 10, if you will, that kind of a thing about, we talked already about heavy metal toxicity in the body. Talk about some of the natural ways we can actually improve our health.
Okay, excellent question. And Jonathan, the good news is a lot of these aren't expensive, okay? These are not expensive things to do. Here's the biggest one I can tell you, CR. I was at a seminar, and this guy writes up on the board, he writes CR. And he says to the class, he goes, so how do you extend your life? What's the best, only way, scientifically proven way to extend your life? And people are going, hormones, balance your hormones, no. Nutrition, no. Exercise, no. CR, caloric reduction. Eat less. Hey, this is good news, folks, because we can eat less if you reduce your calories, and I'm talking about reducing sugar too, but this is the only method scientifically proven to increase your lifespan, okay? So eating one way, or eating less, is the sure way to increase your health and live a longer life. Plus, it's good news, we don't have to eat that much, as we age, because it also creates less free radical oxidative stress, less stress on your body. Okay, proper oxygenation. Our cells are 70% water, and then the amount of oxygen that can dissolve in this water is governed by pH. So pH is a huge factor. So water becomes a huge deal. Make sure that you're drinking enough pure water. Detox. Often get an air purifier. Now, when I say detox, what I mean is please don't start any kind of a detox, like a liver detox or a gallbladder detox, until you have your colon moving. Make sure that your bowels are moving before you do any kind of a detox. Periodontal health. Make sure that you go to your periodontist or your dentist and you say, hey, do I have any periodontal pockets? Do I have any dental infections? Have them do a panoramic film. Have them do a full mouth x-ray. Make sure that you don't have any infected root canals or any infected areas in the bone around the teeth. And one of the things that we've just gotten into, Jonathan, in our clinic is ozonation and biooxidative therapies, which is a really great way to increase your health, is to increase your oxygen levels. That's a little bit more difficult to accomplish. But make sure your thyroid hormone is working, get rid of your dental infections, exercise. You need to exercise, and what I'm talking about, I'm not just talking about running and jogging, I'm talking about weight lifting. You have to lift weights, you have to increase muscle mass. Nobody begets osteoporosis until they begin losing muscle mass. So take care of your leaky gut syndrome. Okay, stomach problems. Here's the thing. We've said disease starts in the gut. Make sure you're on the right probiotics. Make sure you have lactobacillus. Make sure you have bifidobacteria. bacteria, and there's another one called Saccharomyces boulardii. Okay, and that's you can get through a number of different companies. And understand that your microbiome, or these bacteria that are in your gut, are beneficial. Okay, but you need to have enough stomach acid. Most of your problem when you're having gas and bloating is not too much acid, it's too little acid. That's one of the physiological myths that I see a lot. Make sure you're taking enzymes. Make sure you're taking nutritional enzymes and digestive enzymes. And you can get those at any qualified health food store. Here's a big one: cellular membrane integrity. Stop eating trans fats. Stop eating plastic fats. Nobody should be eating margarine. Make sure you're getting essential fatty acids and you're getting them in the right ratio. Again, we've mentioned neurotransmitter balance. We've mentioned hormone balance. Work with a physician. Your autoimmunity. Make sure that your immune system is functioning. Get enough sleep. Okay. Make sure that your NEI axis is functioning. That's your neuroendocrine immune system axis. Iodine. Here's a huge one. Most of us are magnesium and mineral deficient, but we are almost all iodine deficient, Jonathan. And so if you read some of Dr. Brownstein and Jorge Fletches and Guy Abraham's studies on iodine, they will tell you that we are almost all iodine deficient, particularly women. If you compare population studies to the Japanese and the Americans, you'll find that they have far less breast cancer, and it's due to their iodine levels. So make sure you're taking a good iodine supplement. Also a good mineral supplement, and a trace mineral supplement also, because trace minerals is what helps your electrolytic balance inside the cellular membrane. That controls the voltage of your cellular membrane. You remember when we went to school, in high school, it was always the nucleus was the big part of the cell that was the gatekeeper. Remember that? I've got news. It's not the gatekeeper. The gatekeeper of the cell is the cellular membrane, and it's composed of a glycophospholipid membrane, which means there's some sugar in there, right, proper sugar. There's essential fatty acids and phosphate. So if you want to have your cells heal properly, make sure that the cellular membrane integrity is intact. Make sure you're getting enough sleep. Make sure you don't have obstructive sleep apnea. Talk to your dentist about that. Talk to your physician about that. Stress control. This is huge. The HPA axis. You need to get your stress under control, and there's many ways to do it. If you need to seek out counseling, then seek out counseling. Make sure your muscle mass is intact and keep building muscle. There's a body, there's a BIA impedance analysis, body impedance analysis that can tell you your water levels and can tell you your muscle mass to fat ratio. And there's another thing that we have in our house called a vibrational power plate that can actually build muscle mass. Make sure that your mitochondria is doing well. There's all kinds of things you can do to take and support your mitochondrial function. That's your little energy battery. Make sure you're on a good multivitamin, and make sure it has acetyl L-carnitine in it. Make sure if you have cardiovascular issues, make sure you're on a regimen of magnesium orotate, about 600 milligrams a day. Make sure you're taking D-ribose, which is a healthy sugar. Make sure you're taking acetyl L-carnitine, transresveratrol, and essential fatty acids. And when I say essential fatty acids, Jonathan, I'm meaning fish oil. But now there's krill oil and there's chia seeds and all this kind of stuff that works just as well. Okay? Proper oxygenation. Pay attention to what you eat. What you eat controls your hormone levels. And so make sure that you're eating a non-inflammatory diet. Okay, and make sure that you've got enough DNA protection via, have your methylation pathways checked out. And there's a simple test, there's a genomic test called 23andMe. You can ask your nurse practitioner, your physician, your dentist about that, or your chiro guy. So that's a few things. We could kind of keep going on and on here, but that's a few things that you can do and really don't cost a lot of money. But and then, like you said before, Jonathan, controlling your stress levels, and just don't sweat the small stuff. There's enough big stuff to go around.
Without a doubt, Dr. Thom, you just gave a huge list, but just to sum up as we close out this program, clearly I did so many of these things just to share with you personally about meditation and eating organic, healthy foods and having the best high-quality supplements and on and on and on. But as I've said so many times before, the whole point of doing a summit like this was to really highlight for people who are so into natural health and natural living like I was, to not overlook problems in the mouth. Here it is, you're eating healthy foods, you're taking the best supplements, you're trying to live that kind of quote-unquote right lifestyle, do right by people, but deep inside, I knew something was really wrong. I was pouring all these poisons in my body, and yes, I was young enough, I could handle it, on and on and on, but I really decided to clean up issues in my mouth for my future self. So I'm sure that's something you would agree, that no matter what else you do, if you ignore what's going on in the mouth, that could be a very serious problem eventually for many people.
Jonathan, you hit the nail on the head. Again, that is absolutely true. I have a lot of patients coming into me, and they're doing everything right. And they say, but, I think I have an infection here. And in fact, they have multiple infections. So the first thing I'm going to tell you is check out and get rid of your dental infections. Okay, get rid of failed root canals, get rid of osteocavitations. Be careful when you're extracting teeth that you do it right, or that your physician and your dentist does it right. Check into the biooxidative therapies, because biooxidative therapies, ozone treatments. We use triozonated oil in our office. We use ozone water, and we use ozone gas. And ozone will increase the oxygenation to the point where it kills all the bacteria. And so you can, within several months, you can take care of all of your dental infections. But like you said, Jonathan, your dental infections just kind of drip down to the rest of your body, and they can cause so many problems with organ systems, with meridian, interference. Get rid of the toxic metals. If you have a gold crown and you have a failed root canal and you have a mercury-based metal filling underneath it all, now you've just set yourself up for a galvanic current, and so now you have like a little electrical battery in there that's messing with your meridians. It's like a little circuit breaker, and it just breaks the chain on that side of your body. I mean, you're well-versed, and we well know about breast cancer and failed root canals in upper first molars. This is cause and effect, and so you just can't emphasize enough, and I think you'd agree, Jonathan, that you need to make your dentist an integral part of your health team. And if your dentist says to you, we're going to use fluoride, and root canals are fine, and amalgam fillings are okay, and we don't mind putting dental amalgam next to your child who's 5 next to his blood-brain barrier, you need to find a different dentist. And we're out there, but we're few and far between. In Nashville, there's maybe a couple of us out there, but I think that this is the wave of the future for dentistry, Jonathan. I really believe that. And, we're passionate about what we do here. You can go to our website and you can check that out. And you can go to the IOMT website. You can go to the Holistic Dental Association website. There's a lot of new organizations popping up now within dentistry, within the dental world. And so we are becoming, and I believe that we're becoming more mainstream on a daily basis. So that's the good news.
Dr. Thom, I want to thank you so much for your time, and I want to thank our listeners for joining us today. If you would like a copy of this program, plus all the other presentations inside the Holistic Oral Health Summit, simply click the banner you see on this page. Thanks again for attending the Holistic Oral Health Summit. We'll talk to you soon. Take care.